have several cases like this, but one that immediately comes to mind of a patient who was very ill with endocarditis, who was admitted to the hospital at Cooper. And I ended up meeting that patient in the hospital. That person was extremely excited for a way out and a treatment program. And we ended up stabilizing that patient on buprenorphine in the hospital. That patient then, after that, ended up following up with us up in the clinic. Had a little bit of a hard time in the very beginning and then slowly stabilized on the medicine over the course of the next probably 2 months, and has since been completely stable. No slips, not gone back to using it all, reunited with family, currently looking for a job, doing really, really well, has a strong engagement in the community here and in the recovery community, and is absolutely happy and glowing every time he walks into the office. We're all really excited to see him. So I know that it's a really, really challenging time, especially with the opioid epidemic. It is a terrifying illness and it has a really high mortality rate. And I see from both sides. I know that when I see patients, they often tell me that they felt completely lost, they had no way out, they didn't know where to go. And unfortunately, there are limited treatment programs now, but there are treatment programs that do exist and programs that are using really good evidence-based treatment, and patients can get better with those programs. So we just really need to let people know that they're available and help them get hooked up into the right programs for them. And the same thing is true in the medical community. I think physicians, nurses, anybody in the care provider community, people don't know that there are really good treatments for this. And I get the question a lot, like, how can you take care of those patients? Or, I can't believe you do that. How could you do that every day? The reality is that my job is extremely rewarding. My patients are wonderful. They're kind, they're caring. This can happen to anybody, as many of us unfortunately know now. And patients, when they get help for this illness, they get better, and it's just beautiful to see. I imagine it's the same way physicians feel when they cure cancer.